Wisconsin, soon became the hardest hit in the nation relative to their size, and their region continues to struggle. Now, though, the whole country's daily average of new cases is as high as it's ever been, over 171,000. The most rapid growth is happening elsewhere. 9 states are reporting more than twice as many new cases a day as they did 2 weeks ago, and none of them are in the Midwest. Those states: Arizona, California, Delaware, Louisiana, Maryland, New Hampshire, New Mexico, Pennsylvania, and, of all places, Vermont, who really had it under control more than anybody. This still reflects a national escalating crisis. Officials warn that things will only get worse if people disregard warnings about travel and get together for the Thanksgiving holidays. With all those airports that we've seen packed, people possibly spreading some germs. Let me be very clear. A Thanksgiving gathering this year may very well lead to a funeral, says Governor Michelle Lujan Grisham of New Mexico, whose state is home to 5 of the 10 metropolitan areas in the country where case reports are rising the fastest. The virus is at large, the governor said. Know the risks and respect them. So, yeah, that is definitely something that you need to take into account with your family, especially if you're going very large distance there. 45 states are seeing sustained increases, and 7 states added more cases in the 7-day period that ended Sunday than any other week of the pandemic. Major metropolitan areas that are reporting new cases at or near record levels all across the country and continent, including Pittsburgh, Albuquerque, Baltimore, and San Diego. Some of them have been pretty bad for a while, like El Paso. They're coping with the flood of hospitalizations that generally follow a couple of weeks behind a rising tide in new cases. A major hospital group in Arizona, Banner Health, began banning most visitors from the facility Sunday night because of the worsening spread of the virus. Yeah, things are just getting absolutely bad here. And the problem is, the reason I think why we see just this lack of cohesion, this lack of just a coherent response to the strategy is because there hasn't been one. There has been no leadership. There's no public influence. There's no one saying, this is how we're going to get you through this. And no one's providing any financial support. No one's providing any support of any kind. Americans are just, at this point, going at it alone and hoping for the best. Like state government, local government failing at just unprecedented levels, and because they're not receiving any support from the federal government. It has to start with somebody at the top who is kind of emanating a clear plan. And while Biden's plan may not be that good, may not be that efficient, at least it will most likely be something more coherent than what we have now. And that's something I think that every American is looking forward to in a large way. Just get some sense of clear direction on this virus. When we have no public plan, no sense of what's next, what's to come, no one telling us how things actually are. I mean, that's what made Andrew Cuomo so effective. Like, people knew what was going on. They knew what was they had to do, and they kind of knew what the future held. Now, what is Andrew Cuomo doing? He's not even doing that. He's just yelling at people about why they're stupid for thinking this or that about the schools and how they need to read the law. Like, that is not in any way it's not in any way helpful to what we need, and just does not really kind of respond to the problems at hand here. Unfortunately, if our cases and hospitalizations continue to increase, we will need to issue further restrictions to protect our healthcare system and prevent more deaths, says this Arizona lady in Banner Health this is Los Angeles County, where the hospitals remain under intense strain. Officials are turning, however, reluctantly to impose or reimpose restrictions in the hope of flattening the curve. LA County has been averaging more than 3,500 cases a day lately, and they were barring indoor restaurant dining, and the outdoor dining would also have to shut down as well, they said, down there in California. So, yeah, very, very tough situation, and there's just it's really awful because there is no economic guidance. There's no economic leadership in that respect. There's no one coming out there and saying, well, this is what we got to do. We're going to send you a check here. We're going to send you this. We're this close to the vaccine. This is what we need to know. Like, it is a very, very tough situation. So, in the world, the U.S. Right now is making up a pretty sizable chunk of the world coronavirus cases. I'd say around more than 1/5 of the coronavirus cases at this point. We are seeing on November 22nd, we saw 141,034 new cases, a 54% increase, which is somewhat flattening, but of course the deaths right behind them. 843 deaths, a 64% increase on November 22nd. So that is a sense of what is going on. It's a little bit, the curve is a little more flat in the world as a whole. But let's talk about some good news. The vaccine here. The drug maker AstraZeneca announced on Monday that an early analysis of some of the late-stage clinical trials conducted in the United Kingdom and Brazil showed that its coronavirus vaccine was 70.4% effective in preventing COVID-19, suggesting the world could eventually have at least 3 working vaccines and more supply to help curb the pandemic. That's what we need. So just as many vaccines as we can get can be distributed as quickly as possible around the world, and that would, of course, help with some of these supply issues. Fauci saying that possibly 20 million people could be vaccinated before January 1st, which is pretty encouraging. So the British-Swedish company, AstraZeneca, which has been developing the vaccine with the help of University of Oxford, became the 3rd major vaccine developer this month to announce encouraging early results following Pfizer and Moderna, both of which said that their vaccines were about 95% effective in late-stage studies. AstraZeneca's results are a reassuring sign of the safety of the vaccine. It came under global scrutiny after AstraZeneca temporarily pushed trials in September to investigate potential safety issues after a participant in Britain developed a neurological illness. Oxford and AstraZeneca said they would submit their data to regulators in Britain, Europe, and Brazil and seek emergency authorization. So that is another 3rd vaccine there that will be absolutely critical in terms of just in terms of slowing the spread and not just slowing the spread, just in terms of increasing and getting life back to normal and actually like restarting society in some shape or form, which is definitely a welcome thing for all here. Again, we're more reporting here from the New York Times about this. We've had all New York Times reporting so far. AstraZeneca's results are a reassuring sign of the safety of the vaccine. It came under, again, this scrutiny, so we know it's a little bit safer than what we thought. The company said its early analysis was based on 131 coronavirus cases. The trials used 2 different dosing regimens, one of which was 90% effective in preventing COVID-19, and the other was 62% effective. The regimen that was 90% effective involved using a halved first dose and a standard second dose. Oxford and AstraZeneca also said that there was no hospitalized or severe cases of the coronavirus in anyone who received the vaccine, and that they had seen a reduction in asymptomatic infections, suggesting the vaccine could reduce transmission. So that is something that would be really, really helpful because of course, those asymptomatic transmissions are what makes this disease so hard to stop. AstraZeneca's vaccine is expected to come with a relatively simple storage requirements, which would be an asset once it gets rolled out. So easier to spread around the globe, more efficient, more can be packaged and sent at one time. The company has said it anticipates the vaccine will require refrigeration, though it has not provided details about how long and what temperature it can be kept. Moderna's vaccine can be kept for up to a month in the temperature of an ordinary refrigerator. Pfizer's can be kept for up to 5 days in conventional refrigerators or in special coolers for up to 15 days, but otherwise needs ultra-cold storage. So they better, it's going to be a whole other thing they have to deal with, they contend with there in terms of just getting this vaccine around properly to people. AstraZeneca has said it aims to bring data from its studies of the vaccine being conducted overseas to the Food and Drug Administration, which would mean the agency would likely review and authorize a vaccine before late-stage data are ready on how well the vaccine works in American participants. British regulators have already been conducting a so-called rolling review of the vaccine, so pretty much just watching it take place as things go. So the review can take a shorter period of time. Today's marks an important milestone in our fight against the pandemic, AstraZeneca Chief Executive Pascal Soriot said. The vaccine's efficacy and safety confirm that it will be highly effective against COVID-19 and will have immediate impact on this public health emergency. So good stuff there. AstraZeneca could significantly strengthen the global effort to produce a vaccine to create population immunity. The price of the shot at $3 to $4 is a fraction of that of some other potential vaccines. And AstraZeneca, maybe because they're a European company and somewhat slightly normal historically, and that's going to be something we're really going to have to watch, and we will be continuing to keep an eye on here in terms of our newsflash editorializing, is who's going to have access to this thing, how easy is it going to be, and how cheaply can families get it, and people who actually need it. Like, will they be gouged out of house and home for it, or will there be more, like, how big will the financial companies or the big pharma companies like just rake on this issue is kind of what we are going to be trying to figure out here. AstraZeneca's results, because they're significantly strengthen this whole thing here. And AstraZeneca has pledged to make it available at cost around the world until at least July 2021 in poorer countries in perpetuity. And that's really what it should be. Like, this is something that, I mean, Jonas Salk with the polio vaccine, he said the thing belongs to people. And in terms of how much public money has been poured into this, how much effort has been poured into this, it is just absolutely wrong and criminal, I think, that people aren't getting this at a fair price. It just got to be $2-3 per shot is really, I think, the most it should be, the most I could justify it being. But we're going to have to keep an eye on it because there's not too much information, because all this is very, very back and forth at this point. Meanwhile, as Thanksgiving approaches, Governor Andrew Cuomo on Monday announced new restrictions in parts of the state where virus cases are rising. The restrictions include a zone in Upper Manhattan, the first time the state has rolled back reopening in the borough under the program of targeting so-called microclusters. So Cuomo warned if current patterns held, the state would hit 6,000 hospitalizations in another 3 weeks. The increase could become steeper if people continue gathering for Thanksgiving in the coming weeks, which he called the Thanksgiving and Christmas as well, which he called the 37 days of the highest socialization of the year. The governor again warned residents not to travel for the holidays, and the state has imposed a 10-person limit on private gatherings in hopes of limiting small parties that he has said have contributed to the resurgence of the virus in the state this fall. Parts of the Upper Manhattan, which including Washington Heights, will now be a yellow zone under the state's tiered color-coded restriction system, and that will limit gatherings to 25 people, with houses of worship limited to 50% capacity. Restaurants can serve up to 4 people at a table. He also said Staten Island is a particular problem. More than 1 million travelers were screened on airports on Sunday, so people are traveling, hopefully wearing masks, but are still very much traveling. So we'll have to see what this does. It's definitely not going to be anything good. The question is, how bad is it going to be? Boris Johnson, meanwhile, is going to be lifting restrictions on many businesses in England next week. We'll see how that goes. The plan will keep substantial restrictions on pubs and restaurants and move that risk friction with some of Johnson's own lawmakers who fear that the hospitality trade will be hit hard by limitations. That's a big, big deal. And, of course, they were emboldened by the new news of their vaccine over at Oxford coming through. Well, that's very, very encouraging. The governor of California is in quarantine with his family after a possible exposure. And they've all tested negative, so that's a good thing for them. A CDC advisory has also discussed which Americans should get shots first, so we know we got a good idea of what we can expect for that. A subgroup of the committee had already stated the healthcare workers, which total about 21 million, should be the first people to have get vaccinations, would make sense. On Monday, it also recommended the next residents of long-term care facilities should be in that initial group. Next would be essential workers, then adults with high-risk medical conditions and those who are 65 or older. Those would be the people kind of going down the line there. Some of the questions the committee considered Monday also included whether people who have already had COVID-19 should not be vaccinated until there is an ample supply. Dr. Robert Atmore, a committee member and infectious disease specialist at Baylor College of Medicine in Houston, said, "At the beginning, where it's a resource-limited vaccine, my opinion is we need to try and target as best we can to those who we know are susceptible, who are going to be more likely to die from this disease, making it less lethal if the people who have it are only asymptomatic, and the people who do have or who are not going to be asymptomatic if they do get it are going to be vaccinated." So that's going to be something that will definitely get things in the right direction. But another committee member, Grace Lee, a pediatrics professor at Stanford University School of Medicine, pushed back, saying much remains unknown about long-term immunity. So there's some disagreement there whether essential workers like police, firefighters, and teachers, as well as transportation workers, should be in the second group to get the vaccine, is another question they were considering. Peter Sizzleguy weighed in. Dr. Peter Sizzleguy, a professor of pediatrics at UCLA, said, "To me, the issue of ethics is very significant, very important for this country, and clearly favors the essential worker group. And especially in Los Angeles, there was a high proportion of minority, low-income, and low-education workers in this group. So it's going to be important that they are treated